Today, let's learn about coronary artery disease. As we also learn from the cardiovascular system that arteries, they carry oxygenated blood to all parts of the body, and veins, they return the oxygenated blood to the heart, and then it pumps it to the lungs for purification. So coronary artery disease develops when your arteries, the major blood vessel that supplies your heart with blood, oxygen, and nutrients, become damaged or disease. So the things that cause it to become disease are cholesterol containing deposit plaques in your arteries, and inflammations are usually to be blamed for coronary artery disease. And another definition of coronary artery disease. So coronary arteries, they delivers a constant supply of blood to heart muscle. When they start to develop fatty plaques, which lead to restriction of blood flow to the heart. As we all know that all parts of the body needs oxygen to perform well. So before diving it into deeper, so let's review the anatomy of the heart. So looking at this heart, we have the arc of aorta. So the coronary arteries, they branch down. So looking at it from the right, we said we have right coronary artery. So that right coronary artery, it delivers blood to the right atrium and right ventricle, and the left coronary artery, it delivers blood to the right left atrium and left ventricle, and the coronary artery too, it delivers blood to the myocardium, the muscle that helps in the contraction of the heart. When plaques build up, they narrow your coronary arteries, decreasing blood flow to your heart. Eventually, the decreased blood flow may cause chest pain, angina, shortness of breath, or other coronary artery disease signs and symptoms. So the signs and symptoms of coronary artery disease are shortness of breath, angina, fatigue, light headache, and a complete blockage too can cause heart attack. Chest pain. You may feel pressure or tightness in your chest as if someone were standing on your chest. The pain referred to as angina. It's usually triggered by physical or emotional stress. It is typical goes away within minutes after stopping the stressful activity. In some people, especially women, this pain may be flattened or sharp and filled in the abdomen, back, or arm. So shortness of breath. If your heart can't pump enough blood to meet your body needs, you may develop shortness of breath or extreme fatigue with exertion. Even though coronary artery disease is asymptomatic, you can have it, but the signs and symptoms may not show. But it will show when the condition is getting worse. So here are the risk factors for developing coronary artery disease. Smoking. So the smoke, it contains nicotine, and the nicotine constricts your blood vessels, and carbon monoxide can damage their inner lining, making them more susceptible to arteriosclerosis. The incidence of heart attack in women who smoke at least 20 cigarettes a day is 6 times that of women who never smoke. For men who smoke, the incidence is triple that of non-smokers. So too, we have high blood pressure. Uncontrolled high blood pressure can result in hardening and thickening of your arteries, narrowing the channel through which blood can flow. High blood cholesterol level. High level of cholesterol in your blood can increase the risk for formation of plaques and arteriosclerosis. High cholesterol can be caused by a high level of low-density lipoproteins, known as bad cholesterol. A low level of high-density lipoproteins, also known as good cholesterol, can promote arteriosclerosis. Diabetes. Diabetes is associated with an increased risk of coronary artery disease. Both conditions share similar risk factors, such as obesity. and high blood pressure. Obesity to excessive weight typically worsen other risks. So for physical inactive, lack of exercise also is associated with coronary artery disease and some of its risk factors as well. High stress, unrelieved stress in your life may damage your arteries as well as worsen other risk factors for coronary artery disease. The complications of coronary artery disease are chest pain, angina. When your coronary artery is narrow, your heart may not receive enough blood when demand is greatest, particularly during physical activities. This can cause chest pain, heart attack. If a cholesterol plaque ruptures and a blood clot forms, complete blockage of your heart artery may trigger a heart attack. The lack of blood flow to your heart may damage your heart muscle. The amount of damage depends in part of how quickly you receive treatment. 3. Heart failure. If some areas of your heart are chronically deprived of oxygen and nutrients because of reduced blood flow, or if your heart has been damaged by a heart attack, your heart may become too weak to pump enough blood to meet your body's needs. This condition is known as heart failure. 4. Abnormal heart rhythm, arrhythmia. Inadequate blood supply to the heart or damage to heart tissues can interfere with your heart electrical impulse, causing abnormal heart rhythms. Tests and diagnosis. The doctor will ask you questions about your medical history, do a physical exam and other routine blood tests. He or she may suggest one or more diagnostic tests as well, including 1. Electrocardiogram, ECG. An electrocardiogram records electrical signals as they travel through your heart. An ECG can often reveal evidence of a previous heart attack or one that is in progress. In other cases, Holter monitoring may be recommended. With this type of ECG, you wear a portable monitor for 24 hours as you go about your normal activities. Certain abnormalities may indicate inadequate blood flow to your heart. Electrocardiogram. An electrocardiogram uses sound waves to produce images of your heart. During an echocardiogram, your doctor can determine whether all parts of the heart walls are contributing normally to your heart pumping activities. 3. Stress test. If your signs and symptoms occur